How's it going, guys? We have a medium difficulty question for microbiology. 46-year-old dude, he has a seizure. His vitals are normal, mild eosinophilia. So we're handing you the diagnosis of a Helminth infection. Okay? So sometimes eosinophils can go up. It's because eosinophils produce major basic protein, which can kill helminths. You should also know that very rarely on NBME exams, you can also get mild eosinophilia with fungal infections. Holy shit. I've seen it for Coccidioides immitis. I've seen it for Aspergillus, for Aspergilloma, where you're like, wait, is this a Helminth infection? No. If you Google it, sometimes you can get eosinophilia even with Helminth infections. Weird, but NBME likes it. CT of the head is shown. Okay, so we'd be doing a contrast CT here if you're doing 2CK3. We do non-contrast CT if you're looking for bleeds, contrast for everything else, infections, abscesses, tumors. Okay, so we have what appears to be a singular lesion here. Fine, we could call it ring enhancing. Let's just hop through. Choice, well, what do we most likely to see as part of this patient's history? Choice A, bear meat consumption's fucking wrong. For USMLE, they want you to know that ursine meat, ursine means bear, okay? Ursine meat can cause trichenosis. So Trichinella spiralis is a nematode, which is a roundworm, and it can cause a triad of fever, periorbital edema, and muscle pain. So it's known as pork worm or pork roundworm, but they like assessing it with bear meat. Okay. Alaska is part of the United States. Okay, so sometimes you can see it up there. Wrong fucking answer. Choice B, beef consumption, wrong fucking answer. So if we stick with parasitology, then this could be Tinea saginata, which is beef tapeworm, a cestode. It's not going to show up on USMLE. I think I've seen it as a wrong answer maybe once, and then you want to study / memorize weird stuff. You're like, wow, beef tapeworm, Tinea saginata. It's not going to show up. Wrong fucking answer. Choice C, fish consumption's fucking wrong. So this could be two major things for parasitology, probably Diphyllobothrium latum, which is fish cestode tapeworm. It can cause B12 deficiency. It's a very rare / obscure cause / intestinal infection. It can also be Paragonymous westermanni, which is a trematode or fluke infection, which can lead to hemoptysis. Okay, it sounds extremely low yield, and it is low yield, but weirdly, Paragonymous westermanni apparently is like one of the most common causes of hemoptysis worldwide. So not in Western countries, but just worldwide, it's a known common cause of hemoptysis. But you get Paragonymous westermanni from crab meat apparently. Okay, wrong fucking answer. Choice D, pork consumption, correct answer. Now, you may have gotten this question right by accident. Okay, the answer is not toxoplasmosis. You see a single ring enhancing lesion here, you think maybe it's toxo. And toxo, it's high yield to know that you can get it from pork in addition to cats and pregnant women, okay? So that is high yield for toxo, but it's not toxo, all right? Toxo is a protozoan unicellular eukaryote tangentially. But this is Neurocysticercosis, and this is Tinea solium. It's a cestode, pork tapeworm. Presumably they went to third world country. Doesn't really matter. We're not sure. Okay, and so cysticerci, so cysticercosis, you can get cysts within muscle. If it goes to the CNS, it's called neurocysticercosis. Now, some of you are going to get annoyed right now. I'll tell you why. Okay, I'm like the oracle. I can tell you what some of you are thinking. The Swiss cheese appearance, if you were to look this up on Wikipedia, let's say, you'll see this beautiful Swiss cheese appearance with lesions everywhere. That's one way the CT can look. Okay, there's 3 different types of CTs I've seen across NBMEs. One of them is the Swiss cheese appearance, very buzzy. The second is this. Okay, you just see a singular lesion. You're like, I don't know, is that a malignancy? Is it an abscess, a toxo? What is it? You can see a singular lesion. The other is you can get more cystic bubble appearing lesions within the ventricles. Okay, so This is tinea solium here. You got to think about which ones could go to the brain, really. I didn't give you, like, these other ones don't do that classically. Neurocysticercosis is the one that does it. Okay, but yeah, they could say he went to Nicaragua or something and ate pork down there. I mean, it's kind of too easy if we do that. These Helminth infections, there's no hard rule, but the nematodes, the roundworms, we tend to treat with the bendazoles, like mebendazole, albendazole. Those inhibit microtubules. But like neurocysticercosis is weirdly one of the cestode infections that you can give albendazole for. Like we tend to use praziquantel for cestodes and trematodes, and then we use bendazoles for the nematodes. But there's a little bit of overlap. Okay, if you didn't know, if you're some family med physician outside somewhere, you have no idea how to treat it, and you were to just give any one of those agents, it would work. But I'm just telling you, because there is an offline step 1 NBME question where they do expect you to know the difference. They give you some like trematode infection, and it was praziquantel. It wasn't mebendazole, so they could rarely make a distinction there. So, and praziquantel causes worm paralysis by increasing calcium permeability. Okay, there's other weird treatments like ivermectin. You can use for onchocerca That's like that's a nematode, filaria. Shows up on one of the NBME exams. They say filariae. Filariae are nematode infections that you get from bites, and black fly transmits onchocerca volvulus. They use ivermectin for that one. Diethylcarbamazine, I don't really think that shows up. It was a weird drug we used to study back in the numerical step 1 era. Garbage. Should I see walking barefoot? Wrong fucking answer. Threw this in here, be a flagrant asshole, because there are questions where they have that. For USMLE, there's 2 main things. Number 1, Strongyloides stercoralis. Okay, so that's a nematode that enters through your feet. They'll say a girl was running around in barefoot in rural Louisiana and has GI disturbance and eosinophilia, and they'll ask you like how she acquired it, and it was like through the feet. I mean, as opposed to consuming something. It enters through the feet, travels in the blood to the lungs, and then it ascends the respiratory tree and then is swallowed down into the GI tract. And then, so I said there's 2 things. That was one of them. The second is the hookworms. Okay, so hookworms, Ankylostoma duodenale, Necator americanus. The hookworms cause microcytic anemia. Okay, they go through that same cycle down into up to the lungs, to the GI tract, and they suck the blood, cause iron deficiency anemia. Wrong fucking answer.